everyone, my name is Masha Shankarenko, and today I would like to talk about Ukrainian government's response to COVID-19. From the beginning of the epidemic in Ukraine, many ordinary Ukrainians met with nervous laughter the official rhetoric of the state regarding their efforts to prevent the spread of the virus. While the entire world has anticipating an implacable toll on healthcare systems, Deputy Health Minister and the leading expert on infectious diseases Viktor Leshko announced Ukraine's full readiness to track COVID-19. In late February, just 2 weeks before the official lockdown and 3 days before the first COVID-19 case was registered in Ukraine, Leshko proudly declared that Ministry of Health had all the necessary tools to handle the outbreak. And I quote, "Ukraine has 12,000 beds in infectious facilities, around 2,000 infectious disease doctors, and 5,000 medical staff. There are isolation wards in Ukrainian hospitals. Also, there is no problem with virus testing." End of quote. This discourse has been daily reiterated by various public officials. Meanwhile, almost immediately, doctors from all around Ukraine pleaded for help, complaining they had no basic things like masks or protective uniforms, let alone medicine. Statistics show healthcare workers in Ukraine are the most vulnerable group. Roughly 19% of all COVID-19 infections are among healthcare workers, a high rate compared to other countries, like 2% in the US, 9% in Italy, 6% in Netherlands, 2% in Germany. In contrast, salaries of Ukrainian healthcare workers are among the lowest in the world, $250 per month. Medical staff in Kiev and Kharkiv called on strike and protested against a lack of protective suits and low wages. While public transport shut down in Kiev, many were forced to quit their jobs as they couldn't commute. Kiev City Clinical Hospital was closed because all medical personnel in neurology, cardiology, and different therapeutic wards has tested positive for COVID-19. Hospital staff maintains that no measures were taken to ensure adequate safety, and the administration did not provide workers with protective suits, ventilators, gloves, and glasses. Just as healthcare workers bear the brunt of the virus, the COVID-19 patients and anyone with chronic diseases, tuberculosis, HIV/AIDS, autism, diabetes, cancer, remain at an immense risk of medical shortages. It is estimated that already in September, 1,300,000 such patients who rely on state-sponsored healthcare will not be able to have access to their vitally important treatment. So what accounts for optimistic official rhetoric amid such a horrendous situation? Well, undoubtedly, there are many explanations, as no state was prepared to face a crisis of such scale. In recent years, the national healthcare system in Ukraine had been a hotbed of prevailing corruption, squandering resources, stifling innovation, delaying procurement, and neglecting infrastructure. The healthcare minister, Uliana Suprun, who launched a wide-scale progressive reform and uncovered some great corruption schemes, was fired by the current president despite the outcry of the medical and expert community. In fact, over the course of the quarantine, the Ministry of Health has gone through the hands of 3 different ministers with 3 different teams. One of them, Ilya Yemets, openly blocked the efforts of an independent state medical procurement agency to obtain urgently needed protective gear for healthcare workers after the director refused to violate the employment protocol and appoint his protege to a top deputy position. The current minister, Maxim Stepanov, who has no prior work experience in healthcare sector and is known to be a relative of a business partner and friend of Ihor Kolomoisky, an oligarch associated with Zelensky Rise, continues to block pending medical procurements using various bureaucratic hurdles, corruption schemes, thus depriving both healthcare workers and patients of vital medical supplies. Plunged into crisis, hospitals rely on local budgets, charity organizations, individual volunteers, and private socially responsible businesses to step in, while the officials in charge are looking for loopholes and schemes to extract more state resources. For example, a well-known child cancer charity fund, Tablеточки, had to use donors' money not on hospital renovations and medical staff training as they planned, but on urgent purchase of vital medication that should have been provided by the state. With borders closed and flights cancelled, even charities and volunteers can only do so much to deliver the medication and protective gear. The above example, viewed in the broader context of critical shortages of testing, criminal cases against activists, corruption scandals in the highest echelons of power, arbitrary firings, and equally arbitrary and puzzling appointments, all this clearly points to direct attack on the fragile progress achieved by the previous government, and an attempt to use the momentum to take more power and further extract public resources. In a movie dedicated to the first anniversary of his presidency, Zelensky, in a familiar fashion to distance himself from the failures of his colleagues, for the first time acknowledged the deplorable condition of the healthcare system, and yet he placed the blame on the pioneers of reform who have started to eliminate corruption and inefficiency by optimizing financial flaws, establishing transparent relationships between patients and doctors, launching accessible medication programs, and introducing the notion of public health. Perhaps this could all have been averted if only the president had not initially chosen to undermine the badly needed healthcare reform, and if his cadre policy had focused on professionalism and competency rather than client-patron relations. Perhaps this would make it less frantic too.